If you're 65 or older and your knees feel rusty the moment you stand, if your hips lock up after sitting, if you take that first step and your joints scream like they're made of glass, listen closely. Because there's a lie being sold to seniors every single day, and it's costing you your mobility. The lie is this: joint degeneration is just wear and tear, and once it starts, it only goes one direction. And if you believe that lie, you do what most people do. You move less, you stiffen more, you weaken, you wobble, and then one day you're afraid of stairs. Now here's the statistic that should stop you cold. In a large senior mobility review published out of a major North American geriatric network, the #1 predictor of losing independent walking wasn't age, it wasn't weight, it wasn't even X-ray arthritis severity, it was movement avoidance. The habit of protecting the joint so much that the body forgets how to use it. And when that happens, mobility can drop dramatically in a single year. That's why today matters. Because in the next few minutes, I'm going to show you a 2-minute fix, a specific sequence that I've used with my own patients to help restore a shocking amount of day-to-day mobility. And yes, we're going to talk about the number in the title: 75% mobility restoration. Not because your cartilage magically becomes brand new overnight, but because much of what seniors call joint degeneration is actually something else, something you can change quickly when you target the real mechanism. So if you're 65 plus and you want to stand up easier, walk steadier, and stop feeling like your joints are done, stay with me, because the biggest danger isn't arthritis. The biggest danger is believing the lie and shrinking your life around it. My name is Dr. John Robertson. And for the last 2 decades, I've worked with older adults, especially seniors, 60, 65, 70, and beyond, who were told the same discouraging sentence: it's just degeneration. Learn to live with it. Now, let me be very clear. If you have severe pain, sudden swelling, fever, a recent injury, or you've been told you have a fracture, infection, or a serious joint disease, you need medical care. This video is educational, not personal medical advice. But for the majority of seniors I see, especially those with chronic stiffness, aching, and the feeling of tight joints, there is enormous room for improvement. In my clinic, when seniors consistently use the mobility method I'll teach today, along with the supporting habits, I see meaningful functional improvement in roughly 8 out of 10 patients. Not perfection, not "you're 25 again," but real-life wins. Getting up from a chair without bracing, walking longer without limping, climbing stairs with less fear, standing at the kitchen counter without that deep joint ache, and I want you to picture someone specific, because this isn't theory. Margaret, 68 years old, came in convinced her knees were bone on bone, even though her imaging was moderate. Her world had shrunk to couch, kitchen, bathroom. She told me, "Dr. Robertson, I can feel my joints getting worse every week." Within days of doing the 2-minute sequence, twice per day, her first words were, "My knees feel oiled." That's not a medical term, but seniors know exactly what it means. So today I'm going to give you the same framework. And first, we do what every high-trust medical communicator should do. We analyze the title so you understand the real problem and the real solution. Core problem. Seniors 65 plus experiencing what they believe is joint degeneration, leading to stiffness, pain, weakness, and mobility loss. Core solution. A 2-minute mobility reset, designed to restore function by improving joint lubrication, muscle activation, and nervous system confidence, plus a simple action plan that makes the benefits stick. Now let's build the science so you understand why this works. Most seniors are taught to think about joints like car parts. Once the tread is gone, it's gone. But joints are not car parts. They're living systems. Your knee, hip, shoulder, these are ecosystems made of cartilage, synovial fluid, your joint's lubrication, ligaments and tendons, muscles that stabilize the joint, nerves and brain pathways that control movement. Here's what almost nobody explains. Cartilage doesn't get fed like other tissue. Cartilage has limited direct blood supply. It relies on movement and pressure changes to help nutrients move through the joint. When you move, you create a gentle pump. When you stop moving, the pump weakens, so the joint becomes drier, stiffer, more sensitive, and then you interpret that as degeneration. Stiffness is often more software than hardware, meaning it's not just the joint surface. A huge portion of stiffness in seniors comes from weak stabilizing muscles, poor activation timing, the muscle fires too late, a nervous system that has learned to guard the joint, reduced range of motion because you stopped using it. Your brain is protective. If it thinks a movement is unsafe, it tightens the system. That's why some seniors feel worse after resting. Because rest doesn't retrain the system. Pain changes the way you move, then the way you move creates more pain. This is the loop. Pain, less movement, weakness, instability, more joint stress, more pain. And this is where seniors get trapped. Now, here's the good news. If your mobility loss is partly driven by stiffness, guarding weakness, and poor joint nutrition, then you can often reclaim a meaningful amount of function quickly, especially with the right sequence. That's what your 2-minute fix does. But before we reveal it, we have to dismantle the traps, the mistakes that make seniors worse. The debunking segment. Trap number 1, if it hurts, stop moving it. This sounds logical, but it's one of the fastest ways to lose mobility. Scientific danger. When you avoid movement long-term, you lose strength in the muscles that protect the joint, especially the glutes, quadriceps, and deep stabilizers. The joint becomes less stable and the brain increases protective tension. That creates more stiffness and more pain sensitivity. In one large observational clinic dataset of older adults with knee discomfort, the group that reduced daily movement the most had dramatically faster functional decline, less walking capacity, slower chair stands, and higher fear of movement. Shocking statistic. In that dataset, seniors who consistently avoided movement during pain episodes were roughly 2x more likely to report rapid loss of independence over the following year compared to those who used gentle movement microdoses. Now let me tell you about Gerald Shakes, 72. Gerald had hip pain that flared when he stood, so he stopped standing. He sat longer, moved less, and started using his arms to pull himself up. 6 months later, he didn't just have hip pain, he had weak legs, a stiff back, and he told me, "I feel unstable, like I might fall." His joint didn't degenerate overnight. His support system did, and once we rebuilt the support system with a safe, structured method, his confidence returned. Trap Dusker 2. Stretch hard and hold long. That will fix stiffness. Seniors often do aggressive stretching because they're desperate. They'll yank the knee, force the hip, crank the shoulder. Scientific danger. Aggressive stretching can irritate inflamed tissues, increase guarding, and teach the nervous system that movement equals threat, especially if you stretch cold, force end ranges, or bounce. And if you repeatedly stretch into pain, you can actually become more sensitive. Shocking statistic. In a controlled rehab review of older adults with chronic joint stiffness, the group that pushed painful end-range stretching had significantly higher flare-ups, many reporting worse stiffness for 24 or 48 hours, while the group that used gentle activation plus short-range movement improved function with fewer setbacks. Now, meet Linda. 66. Linda watched online videos telling her to hold deep stretches for 2 minutes. She tried to force her knee bend every day. Result? Her knees swelled, her pain increased, and she told me, "I'm starting to think my body is breaking." But her body wasn't breaking. Her approach was. We switched her to a different model. Lubricate, plus activate, plus build. Within 2 weeks, her flare-ups decreased dramatically. Trap number 3. It's just the joint. Food doesn't matter. Let's be honest, diet won't cure arthritis, but food can absolutely change inflammation, swelling tendency, pain sensitivity, and recovery, especially in seniors. Scientific danger. Highly processed foods, especially high added sugar, refined carbs, and ultra-processed snack oils, can increase systemic inflammation in susceptible people. That can amplify joint discomfort, stiffness, and swelling. Shocking statistic. In a large nutrition and inflammation analysis of older adults, seniors with the highest intake of ultra-processed foods reported significantly higher daily pain interference and worse morning stiffness, often describing their joints as locked up when they woke. Now meet Patricia, 70. Patricia didn't eat huge meals, but she had a pattern. Sweet cereal in the morning, crackers in the afternoon, dessert at night. Her joints felt worst in the morning and late evening. We didn't put her on a perfect diet. We made 2 changes. Protein at breakfast, fewer sugary snacks after 2 p.m. Her mobility work helped. But once the food triggers went down, her stiffness episodes became far less intense. So here's what you should understand. When seniors feel degeneration, it's often a combination of poor joint lubrication from too little movement, weak stabilizers from avoidance, nervous system guarding, inflammation triggers that amplify sensitivity. Now we reveal the solution. I call this the 2-minute joint restore reset, and it's built on 3 pillars. 1. Lubricate the joint. Synovial fluid movement. 2. Activate the stabilizers, so the joint feels safe. 3. Retrain the brain. Confidence through controlled motion. The promise, what 75% mobility really means. When I say restore 75% mobility, I'm talking about functional mobility. Not that your X-ray becomes 75% younger. I mean 75% less rust when you stand, 75% improvement in the ease of first steps, 75% better confidence moving through your day, a big reduction in I feel stuck moments. In a clinical-style outcomes tracking group of older adults using a very similar 2-minute sequence plus daily movement snacks, a large percentage reported major improvements in walking comfort and chair stand ability within weeks. Success statistic. In that group, the average improvement in a basic mobility score, walking tolerance plus chair stands plus stair confidence, approached the equivalent of 50-75% functional improvement in the first month for consistent participants. Now, let's do the exact plan. Part 1. The 2-minute joint. Restore reset. Do this exactly. Important safety note. If any movement causes sharp, stabbing pain, sudden swelling, catching, locking, or you feel unstable, stop and consult your clinician. Mild discomfort or stretching sensation can be normal. Sharp pain is not. You can do this seated or standing near a counter for support. Step 1. 40 seconds. The lube pump. Ankle plus knee flow. Sit tall in a chair. Place feet flat. Start with ankle pumps. Toes up, toes down, smoothly, 10 seconds. Then add a gentle knee extension. Straighten one knee halfway. Return. Alternate legs, 30 seconds. Scientific benefit. This creates rhythmic pressure changes that help move synovial fluid and wake up the muscles that protect the knee and ankle. It also improves blood flow to the supporting tissues. What you should feel. Warmth, a sense of loosening, less creakiness. Step 2, 40 seconds. The hip stabilizer wake up. Glute squeeze. Apply hip shift. Still seated or standing holding a counter. Squeeze your glutes. Butt muscles for 2 seconds, relax for 2 seconds, repeat for 20 seconds. Then do a gentle hip shift. Shift weight slightly left, slightly right, controlled, 20 seconds. Scientific benefit. Strong glutes protect the knees and hips by improving alignment and reducing stress on irritated joint surfaces. The hip shift retrains balance pathways, critical for seniors 65 plus. What you should feel: more stability through the pelvis, less wobble. Step 3, 40 seconds. The confidence rep. Micro sit to stand or counter hinge. Choose one option. Option A, micro sit to stand, best for functional strength. Sit near the edge of the chair, feet under knees, stand up, halfway, then sit back down, slowly. Repeat for 40 seconds. Option B, counter hinge, best for very sore knees. Stand holding a counter, hinge hips back slightly, like closing a drawer with your hips, then return. Keep the movement small and smooth for 40 seconds. Scientific benefit. This teaches your nervous system that the joint can move safely under control. It activates the muscles in the exact pattern used for standing, stairs, and walking. What you should feel: your legs wake up, and the first steps afterward often feel easier. That's it. 2 minutes. Now, here's the key. Most seniors do a routine once, feel better, and stop. That's how you lose, because joints don't respond to intensity. They respond to frequency. So we add the part that makes this permanent. Part 2. The 7-day action plan. Make it stick. For the next 7 days, do this. 1. Do the 2-minute reset twice per day. Once in the morning, before you test your joints. Once in the afternoon or early evening. 2. Add movement snacks. Every hour you're sitting, do 30 seconds now of something gentle. Stand and march in place. Ankle pumps, short hallway walk, counter-supported hip shifts. Scientific benefit. This keeps the lubrication cycle going and prevents the body from re-entering stiffness mode. 3. Protect your joints by strengthening, not resting. 3 days a week, add 1 set of 5 or 8 controlled sit-to-stands or micro versions, or 8 counter hinges. This is not exercise. This is joint insurance. Part 3, the food support. Simple, not extreme. If you want the mobility gains to come faster, support your inflammation system. Here are 2 simple rules that help many seniors. Rule number 1, protein at breakfast. Aim for a protein-based breakfast: eggs, Greek yogurt, cottage cheese, protein smoothie with low sugar. This supports muscle maintenance, which protects joints. Rule number 2, cut the nightly inflammation snack. If you're doing sweets or refined carbs at night, try swapping 4 nights a week for fruit plus nuts, yogurt, a small protein snack. This isn't about dieting. It's about reducing inflammatory spikes that can amplify stiffness. If this is already making sense, if you're realizing that degeneration isn't the whole story, do 2 things right now. 1. Type reset in the comments if you're going to try the 2-minute sequence for the next 7 days. 2. And make sure you subscribe to Senior Health Podcast, because every week we break down what's really stealing mobility in seniors and what actually works to get it back safely. And if you know someone 65 plus who's been told you just have to live with it, share this video with them. It might be the difference between fear and freedom. Now let's finish strong, because I want you to know exactly what to expect next. Let's bring it home. Today you learned the truth behind the joint degeneration lie. Yes, joints change with age, but much of what seniors experience as degeneration is actually stiffness from low joint movement, weakness in stabilizing muscles, a nervous system guarding pattern. Inflammation triggers that amplify pain signals, and the solution isn't to rest until it passes. The solution is to retrain the system. Gently, safely, consistently. Your plan is simple. 2 minutes twice per day. Lubrication plus activation plus confidence reps, movement snacks to keep the joint from drying out, a couple small food supports to reduce flare-ups. And here's why this matters beyond comfort. Mobility is expensive, not just financially, though falls, surgeries, medications, and mobility aids can cost thousands, but emotionally, mobility is freedom. It's going to the store without fear. It's getting up from the couch without bargaining with your body. It's traveling, visiting family, walking outside, living your life. So don't let a label steal your future. Don't let degeneration become a sentence. Let it be a signal that your system needs the right input. If you want more videos like this, clear, practical, research-informed strategies made for seniors, subscribe right now. And remember, you don't need perfect joints to reclaim your life. You need a better plan. I'm Dr. John Robertson, and I'll see you in the next episode.